My name is Ashley Pickering Brown, and I am an endocrinology nurse practitioner and the diabetes educator at Emerson Hospital. Cardiovascular disease is the leading cause of death and a major cause of heart attacks, strokes, and heart failure for people living with type 2 diabetes. Yet a recent survey of people with type 2 diabetes showed that only half have discussed their risk for heart attacks or strokes with their healthcare providers. If you have diabetes, your chance of having a stroke are 1.5 times higher than in people who don't have diabetes. But you can lower your risk by taking care of your health. Diabetes is a condition that results in blood sugar rising to dangerous levels. Blood sugar, also called glucose, is your main source of energy and comes mostly from the food you eat. In your body, glucose is regulated by insulin. Insulin is a hormone that helps your body's cell absorb the glucose from your blood and use it as energy. When you have diabetes, you either don't make enough insulin or can't use your own insulin as well as you should, sometimes both. This causes sugars to build up in your blood and eventually causes damage to the blood vessels and body organs. Many of the risk factors for type 2 diabetes overlap with risk factors for having a stroke. These risk factors include age 45 or older, having a family history of type 2 diabetes, having been diagnosed with prediabetes or gestational diabetes, have a history of heart disease, high blood pressure, and high cholesterol, are overweight or obese, and have a sedentary lifestyle and unhealthy eating habits. There are critical health numbers you should be familiar with in order to manage your diabetes. Real-time monitoring of diabetes is based on a blood glucose test. Normal glucose is less than 100 milligrams per deciliter. Diabetes is diagnosed at 126 milligrams per deciliter or higher on at least 2 occasions. An A1C measures your average blood sugar level for the past 3 months, and an A1C above 6.5% is considered a diagnosis of diabetes. Changing your habits is key to managing your diabetes and preventing heart disease and stroke. You can reduce your risk of stroke by taking these steps. Manage your diabetes by creating a plan with your doctor that includes appropriate medication, lifestyle changes, and monitoring. This includes having regular medical checkups and sometimes seeing a diabetes educator or endocrinologist. Control your blood pressure and cholesterol with appropriate medications, diet, and monitoring. Don't smoke and avoid secondhand smoke. Eat a healthy diet and reach and maintain a healthy weight. A registered dietitian can help you create a meal plan that works with your preferences and lifestyle. Be physically active. Aim for at least 30 minutes of moderate physical activity per day, but know that any activity is better than none. Get adequate sleep and manage stress and well-being. Emerson Hospital has a team of endocrinologists and an American Diabetes Association accredited diabetes center available to assist you on your journey managing your diabetes.